Thank you very much, and good afternoon, everybody. It's good to be here and to have the opportunity of sharing some examples of good practice from the Association of Colleges with you all. This is the contents of the presentation today. Just to start with introductions, Ian Ashman. I was until August the principal of Hackney Community College in East London, an area which has amongst the highest proportion of residents with mental health issues. And I will talk about my experience, but just to be clear, I'm not an expert mental health practitioner. I'm talking as somebody from a leadership position in a college which took these issues very seriously. I'm going to share with you mental health issues and concerns in colleges, particularly those that have arisen from a survey which the Association of Colleges did of its members. I'll talk about agencies supporting young people and adults, partly because I want to refer to a number of them. So I'm sure we've got some very experienced colleagues on the line today, but if you can just bear with me while I explain that for those who are not aware of the variety of agencies who work with young people and adults on mental health issues. I'm going to share a few specific examples that have come up from the work that AoC has done, including my own experience from Hackney. And from that, we've begun to develop a list of key features that we think good providers will offer to support students with their mental health issues. I'll give some examples of mental health resources that are available online. Again, many of you will know about these. And then I'll talk about some of the steps which the Association of Colleges intends to take next to continue to raise these issues and to improve the support that colleges can provide to their students. And then lastly, I'm happy to take questions, and I hope that we'll get some comments and ideas from other people, because I'm quite sure that there are many people who can contribute today who will have things to share. So we'll have an opportunity to do that at the end. Just finally to say, by way of introduction, that my experience in running a college is that however serious the issues are in college, they're seldom a matter of life and death, but actually when it comes to mental health, it really makes that much difference to students. And I've had students who've had support from the college say to me, I would not be here, I would not still be alive if it were not for the support which your college has provided. And those are people who've gone on, done education, gone on to work. So it's an area where good services from colleges, good engagement with mental health services locally really can make an enormous difference. So this is an area of growing concern to colleges. And in 2015, we did a survey of our members about the incidence of mental health issues for students. And what that showed was that over 85% of colleges identified that the number of students with mental health difficulties had either increased significantly or had slightly increased. So that's an enormous change in a 3-year period. And in addition to that, colleges identified, 75% of them, that there was a significant number of students with undisclosed mental health difficulties. So students who hadn't yet disclosed but who had issues which were impinging on their life or their work as a student. And we know from research that other learning and skills providers, so people working with adults in the sector outside of colleges, have very similar experiences. So it's a growing issue. The other thing which we did as a part of that survey was to ask about the reasons for the increase. And colleges identified particularly social media as having an adverse impact. And that's something that's had quite a lot of publicity recently around the fact that we've had Mental Health Day recently and a number of other issues and incidents. The pressure of social media on young people, for example, increasing their poor views of themselves, increasing self-harm, has had a lot of publicity. Colleges also identified exam pressures and financial concerns. And we know that these are generations of students who have had pressure throughout their lives. It's one of the first generations that's been tested almost every year since they started school. And we know financial concerns loans and so on are much more prevalent than they were. And also there are particular types of students who are more likely to have mental health issues. Recent work by Bernardo's and NSPCC has highlighted that care leavers are much more likely to have been abused, and those who've been abused are much more likely to have mental health issues. And some of the students with learning difficulties, who are increasing as a proportion in colleges, are also more likely to have mental health issues. So as a sector, we are far more likely to have both young people and adults who are going to have mental health issues. Now, we've identified a number of different types of students who have mental health issues, and these both overlap and students move between them. We do have some students who have known disclosed needs for mental health support. So, for example, when we have young people who transition to us with an education, health and care plan, some of those might identify mental health needs as a specific thing where the college needs to provide support. We often have adults who are existing users of mental health services, and they may or may not disclose to the college. But in many cases, and I'll share some of those later, the college might engage with them specifically because being in college is a part of the programme of support for those students. We have many students with issues that emerge during their time in college. And one of the reasons for this is that the 16 to 18 age group is one in which disclosure seems to emerge particularly. And also because students are in new settings, they're forming new relationships, they might identify with new tutors and more adult relationships in a way that encourages them to disclose. So we find some young people particularly, but adults too, who've had mental health issues for a number of years but have now chosen to disclose them. And of course, there is that group of students with undisclosed mental health issues, and those might be issues of which college staff are aware or have suspicions, or issues which are undiagnosed by anybody. So I think it's helpful to understand those different groups, not least because it allows us to be aware of the points at which disclosure might happen and support might be needed. So many of you will know about the plethora of mental health support agencies which colleges and other learning and skills providers engage with. Critical now are the local clinical commissioning groups who are responsible for buying local services, but the local health and wellbeing boards and their directors of public health also have a critical role to play. They describe themselves as a leadership forum in order to improve local health services and particularly to tackle health inequality. And both the clinical commissioning groups and the health and wellbeing boards have been asked to increase the proportion of budgets which they spend on mental health services. But you may well have seen locally publicity that those services have not been getting access in many cases to increased resources. A particularly important service for us is CAMS, the Children and Adolescent Mental Health Services, who look after young people up to the age of 18, and then adult social services, who are responsible for those from 19 plus. And a key issue for colleges is the transition from one to another, as I'll describe later. Another group are the acute mental health trusts, who provide clinical services for adults with more severe, both chronic and acute issues. Other people like general practitioners and charities are also critical in the range of support agencies. So the fact that there's many people to engage with can make life more complex, but also means that a college which is engaged with all of those can access a much better range of services than those who are only engaging with one or two. Now, that plethora of agencies is one of the features that creates challenges for colleges in supporting mental health issues. So amongst those issues are a lack of awareness amongst our own staff of issues and symptoms, a lack of information that comes to us when students progress to us from earlier stages of education, Many of you will have had experience of having students who have disclosed a variety of issues or had support in the past. This might just not be for mental health, but many other things, but where there is no information comes across the transition point. There's certainly a decline in services, and many colleges have reported that they've had to reduce the amount of student support in colleges as a result of the major reductions that happened in college budgets. We know particularly budgets for adults were reduced. In fact, we've just seen today figures published for the latest allocations for adult funding in colleges, which shows them at about half where they were in 2009, and that's obviously had a knock-on impact. I mentioned the importance of the CAMS service, but we know nationally that about 30% of referrals by professionals for support through CAMS are rejected because they don't meet the threshold. And even where we do get people to get support from CAMS, they may find that that support falls away at the point where they reach the transition at age 19. And many of our students cross that transition because many students come to us not at age 16, but at age 17 or 18. And a particular issue of concern to the Association of Colleges is the lack of engagement by the mental health system with colleges. And this goes right from national level and departments, which will often talk about schools and universities, but not mention colleges, down to the local system, the health boards, the clinical commissioning groups who might think about schools but may not think about the importance of colleges. So we're aware of those challenges, and the Association of Colleges is working nationally and regionally to address those challenges. So we have raised those issues with ministers and officials, and I was really pleased that one of my very first meetings as president of the Association of Colleges this year was with ministers from the Department of Health and the Department of Education together, and with their officials to raise some of these concerns. We have people on the Department of Health's reference and advisory groups, and we're using that to encourage those departments to ensure that services that are available to schools are available to colleges, and that the language of those departments is college inclusive. In other words, when they're writing, talking about good practice to health and wellbeing boards and clinical commissioning groups, they're encouraging them to think not only about schools and universities, but colleges and other learning and skills providers as well. At a regional level, we've got work going on to encourage those health and wellbeing boards and CCGs to think about colleges and to invite college principals or practitioners onto the wellbeing boards. And these are all issues which AoC is working on, but which individual providers can work on at a local level as well. So moving on to good practice, one of the things we're very keen to do is identify good practice in order to share it. And that will enable us to build up, we hope, a directory of good practice which we can share, not only about good practice that colleges undertake, but good practice in the engagement between colleges and their mental health systems. So we have 3 examples here: Liverpool City College, where the clinical commissioning group have funded 2 mental health advisor posts in their college. Highbury College Portsmouth, which has secured a place on the clinical commissioning group, and that's led directly to improvements in the support available to students. In Birmingham, the colleges have been able to lobby together to encourage the clinical commissioning groups, and they're now looking to commission mental health support services, not for 16 to 18s and adults separately, but to do so across the 16 to 25 divide, which we think would be something to do really right across the country. And I'm going to share a couple of more detailed examples. First of all, from Great Yarmouth College. In Great Yarmouth, the principal, Stuart Rimmer, has written extensively about mindfulness, and those of you with access to the AoC resources might have seen his blog on Friday about mindfulness. And he talks about mindfulness as something which he's trying to achieve right across the college, not only with students, but also with staff. There's some quotes there about what mindfulness is about. But students identified that the lack of mindfulness means that students hang on to their negative emotions long after the moment has passed. And that gets in the way of their being successful and thinking about the future. And he says both for staff and students, it gets in the way of good decision making. So he's identified that teaching staff and students mindfulness can give them the power to make better decisions and improve their decision making and their ability to study and be successful, both as students and in life. And I think that's an interesting approach because it begins to highlight one particular issue, which is about the importance of good mental health, not only for students, but for staff as well. And moving on to my own college's example, in Hackney, we had 2 well-qualified and very experienced mental health advisors, one which we supported through the college budgets, particularly working with young people across college, and one which is a very long-standing role funded by an acute mental health trust, mainly aimed at mental health service users with very serious challenges, including some with criminal behaviour. And in that particular case, the Mental Health Trust identified that participation in education had enormous therapeutic value. I remember a director saying to me, I get better value out of having an advisor from the college working with my clients than I do from employing an additional mental health nurse or from spending more money on drugs. Because what they did was engage with people, even going onto the wards, getting people engaged with college, making them aware of what they could do in college, and then supporting them once they started introductory and then general college courses. So those advisors had an enormous impact, more than 500 individual students supported, many more through group sessions. But also their role was to support staff, and that might be giving staff advice. Many staff are unused to working with people with mental health issues and they find it quite challenging. So having somebody that they could talk to, get advice from, and in some cases even talk to about their own mental health concerns. So those effectively increase the resource available by getting all the staff across the college being able to support those people perhaps with lower level concerns so that the expert advisors can provide support to those in greatest need. So from our work to date, we've been able to identify what we think are some consistent features of colleges and other learning and skills providers around mental health. So the first is about having clear policies and systems to support mental health of students and staff, but doing so as part of a wider range of wellbeing policies. So good mental health support is a feature of good support for students generally. And I think that's interesting and important because under the Ofsted inspection framework that came into place last year, for the first time, there is an explicit grade for student behaviour, welfare and support. So good practice in this area is seen as very important. Having dedicated support who can provide support to students with mental health is important. That may be an expert advisor, or it may be, in the case of a smaller institution, having a student support worker or counsellor who's had specific mental health training. Running mental health wellbeing sessions for all students is important. Everybody has stresses, and that's particularly true in exam time. But making students aware means that they can also be another pair of eyes and ears who can look out for their friends. And having strong programs of support, recreational and physical activity, we find is very good practice in terms of assisting people to improve their mental well-being as well. And then a few more key features. Having all staff within the institution, both teaching and support staff, aware of mental health issues is good practice. That's done well through face-to-face training, or it could be through an online course, and I'll give an example of one of those in a moment. We also think it's good practice for every college to have staff trained in mental health first aid. Every college will have first aiders, but they can also have mental health first aiders, and ensuring there's a rota, so there's always a mental health first aider on site and available to students in crisis moments is important. We also think, for reasons I've described already, that having a strategic relationship with your local Director of Public Health, your Health and Wellbeing Board and the Clinical Commissioning Group is good practice. And that may be something which an individual college can do. In some cases of large colleges, they might have a number of CAM services to deal with, or it could be the number of colleges and providers can get together and nominate a representative to represent them on those boards and groups. So here's some examples of some of the resources available to support professionals. The MHFE organisation that we're working through today has many resources available to support professionals as well as to support students. Young Minds is an excellent source of information and advice, again, not only supporting professionals but students and their parents. And MindEd is particularly useful, and MindEd has an online staff mental health awareness course which people can undertake. We also came across this specific guidance for staff who want to teach students about mental health issues. It is quite school focused because it comes from the PHSE curriculum, but there's some good advice there which you can share with curriculum colleagues. In terms of next steps, I've identified that during my year in office as president, I would like this to be the year of mental health in colleges, and we're focusing on promoting mental health support as one of the key policy issues this year. We're going to rerun our mental health survey at the end of November and beginning of December to look at how the scale of need and awareness of the issues and good practice has changed since we did the last survey, which is nearly 2 years ago. We're seeking some funds at the moment from a variety of funders to document our good practice, not only what's happening in colleges, but also in the engagement between colleges and the mental health system. And we'd like to run a conference next year, or perhaps a number of regional events, where we can bring together colleges and people from the mental health support services to share that good practice. And we'll be sharing information, including the initial results from our survey, at our next event on this topic, which is our SEND conference on the 14th of December, and I hope a number of you will be able to come along to that. So thanks very much to you all for listening to that introduction. I'm happy, first of all, to take some questions, and then I hope we'll have a bit of time to share comments and ideas.
Thank you very much, Ian. There is a question whilst other colleagues are typing theirs or formulating them. I shall put this one forward to you. It is about mental health first aid. And the question is about to what level are staff trained? Is it the light course, the 2-day mental health first aid, or the full trainer course, or a mix of both?
Generally, it's a mix of both, so that you've got people who've done the basic introduction, and a number of those, and some colleges are doing that with many staff, but they're perhaps selecting a smaller group of people to do the more detailed and intensive program.
Thank you. Colleagues, we are not a huge group, 15 of us in the room, so if you would like to unmute yourself and contribute questions or comments, please do so, or use chat. Again, whilst you're doing so, I feel that I'm doing something that perhaps Katina is already planning to do, but just in case, because I know she's joining us remotely, i.e. not from home or office, to say that Stuart Rimmer, whom you mentioned, Ian, giving a case study of the Great Yarmouth College work and the blog that Stuart has been writing about mental health issues and some initiatives at the college. Stuart is facilitating a webinar on 28th of October. So that's the last day of webinars that we are doing. So if you're able to join him for breakfast at 8:30, that would be great. And then you can hear firsthand about his work, and the information about that is on the Padlet on the Mental Health in Further Education website or Equalities Toolkit website.
Okay, I've got a comment, perhaps more than a question. It's just wonderful to hear you say that the AoC is really taking this on board and will have a real focus over the coming year. As somebody who's worked in a large FE college, and you see budgets being cut, and you were right when you said earlier that student services has taken quite a hit in order to keep frontline teaching staff in post, and you can see the growing numbers of young people who are struggling with either diagnosed or undiagnosed mental health issues, that it'd be really good to see the AoC taking a lead and sharing all that good practice that you've mentioned in your presentation. So thank you very much for that.
No, thank you for that comment. I really appreciate it.
Ian, thank you so much. It's been a really interesting webinar. My comment is the idea it's given me, which is probably very simple and everyone else is doing it, is that we've been looking at running exam technique workshops for our adults taking GCSE English and Maths. But I've just been writing notes saying, actually, I think we'll do some well-being workshops as well before people do their GCSE English and Maths. And I think, that'll make people feel better supported, but it could, have quite a big impact on our success rate.
Yes, I agree. I think putting the two things of coaching together sounds like a really good idea.
Am I able to say something now? Is it okay to come in? Hi, Sue Ward, and formerly of Highbury College, Portsmouth. I'd just like to ask, I'm aware that you send out principals briefings, and I think we all know that as far as any initiative like this is concerned, it's really important that you have the support coming from the top, as we have in Highbury. So I'm asking really if you're aware that this has become a feature of the principals briefings, if it's a feature of your thrust for the coming year.
Yes, it is something in my first blog, which goes out to principals. I've spoken specifically about mental health and the importance of mental health support to students. But we've also got more detailed work, which is undertaken by my colleague Liz Morsley, who leads on this within the association. So we also have more detailed briefings which are available, and which we hope other college staff as well as principals will access.
Okay, and then I guess just one other question from me really is that you've talked about, Stuart, developing this cross-college approach, which I know some colleges have had in situ for maybe 2 or 3 years now. Have you any idea of an overview as an association how many colleges are actually currently developing this sort of initiative across the whole of the college for health and well-being?
We don't have any statistical data. We know it's on the increase, but one of the things that we plan to do in our survey is to try and collect more accurate data about the approaches which people are taking, including things like how many are adopting the mental health first aid, how many are looking at mindfulness. So hopefully by December we'll have some information we can share with you.
That's great. Thank you very much. Thank you.
Thank you, colleagues. There is another question in the chat. It is from Sam Coles from Central College, Nottingham, and it is about whether in your experience is mental health first aider in practice consumed with requests for support, i.e. is it a full-time role?
I suspect it depends on the institution. So I can only talk from my own experience, and in that particular case, as I've described, we were well supported, and we had 2 full-time roles in the college. I suspect it would very much depend on the size of the institution, and on the number of other specialist resources that were available. Of course, looking at the parallel and first aiders in my college, we shared first aid rota across a group of about 20 people. And so in practice, those people were called on every couple of weeks to do half a day of duty. So that a college could organise itself in the same way. And in that way, with a number of people, you could cover the college without it becoming a full-time role.
Thank you, Ian. I suspect there are more questions coming because I can hear some typing. But in the meantime, if colleagues don't mind, also linked to mental health first aid, Richard Caulfield, a colleague from AoC Northwest.
Yes, Northwest.
Is delivering a webinar on the 21st. So that's this week on Friday. And that I'm aware that in his webinar, he will be making links to the mental health first aid, partly because that's something that was promoted as a theme by the Mental Health Foundation as part of the Mental Health World Day this year, and partly because, again, it's part of those other initiatives that the AoC are making in order to support the mental health agenda. And his is a lunchtime webinar, so 12:30.
Yeah, could I just jump in on that question, or what you just said? Can you hear me? It's Jessica from Southend.
Yes, I can hear you.
Hello, Ian. It might be a better question for the Richard's webinar, but I've been looking into the mental health first aid training for my organisation, and it's just the value for money, because it's quite an expensive course. I mean, do you have any sort of recommendations around that? I think it would be good to embed a whole organisational approach around mental health. Is something we've certainly been talking about, and I think that's probably the next step. So in what way do people do it? I mean, I was thinking go off and train myself or a couple of people and then come out and disseminate it that way, or is there a different model you'd recommend?
I think there are a number of models, and quite often people will start by getting a few people to do the more detailed program. The Association of Colleges, AoC Create, does deliver a program which is an open one where you can send a few people along, or it can come and do delivery inside the college. I think generally what people have done is then supplement that by doing things like the MindEd online awareness program to try and reach all staff. So they might include that as part of a staff development event where they can get people to undertake that training online together, and then have a discussion with some of the people who've done the more detailed training. But yeah, it'd be a good question for Richard, because he knows a number of colleges who've put it into practice.
Thank you, that's great, thank you.
Am I able just to say very quickly, I think, Ian, I'm right in understanding that there are 2 levels of mental health awareness, the certificate. There's the trainer one, where you pay, I don't know, 1,000, a couple of thousand or something, and you get somebody who can then train your organisation, all the people who would hold a mental health certificate in your organisation. So you're only actually paying out quite a sum of money once, and they can then come back and train your staff. I think that's correct.
Yes, yes, that's right.
we do have some contributions in a chat, which I will share with everyone. First of all, Katina, reminding us all that she says, I really think that for parity with physical health, we should train existing first aiders as mental health first aiders so that we have cover at all times and so that we have a strategic approach. First aiders ongoing training is already resourced and people receive a financial incentive to be first aiders. So you add into the cycle and fund it out of that health and safety budget.
Okay.
Now, a colleague has also echoed the view around the cost, that a bit overwhelmed by the cost of the mental health first aid. However, Mind do deliver this 2-day training at a very reduced cost. I'm sorry, I'm just going to take a moment to mute some colleagues because of the background noise. So if you do wish to come in, please do unmute individually. Yes, a contribution from the Hartlepool Adult Education about the cost and saying that the Mind do deliver it for them at a very reduced cost, but that's a lower level training and not train the trainer. Ian, this is a question for you from Tracy Attard, and that's whether you've got online training information that you mentioned and what would be the link to that. This is the Mind Ed online training.
Yes, so when the slides are shared later on, there's links within the presentation to the MindEd website, but it's minded, all one word, .org.uk, I think, from memory.
Thank you very much. I have already posted it in the chat that we will make the slides available on the MHFE website, as well as the Equalities Toolkit website. We do not take the webinar posts down immediately, but we do so in order so that future webinars kind of are there at the top and catch people's attention. But what we are going to do is create another Padlet, which is where webinars are at the moment, with all the webinars that we have held as part of this series, and we'll link the documents, that's the slides and the recordings, to that. So it will feature on both websites in the future. Ian, I'm not sure if you're able to follow comments and contributions in the chat.
Yes, if I could say thank you to Natalie, who's posted that web address.
Yes, thank you very much. Katina's contribution, that from a strategic point of view, we have 3 other groups of staff we need to think about helping to improve how they see mental health. And that is human resources, HRs plus TUs, colleagues?
Trade unions.
Thank you. Senior staff and teachers, all teachers, that is.
I'd certainly agree with Katina on the need to reach all of those groups, and I think there are parallels with safeguarding and the need to make sure that everybody has got the awareness. I know from my own personal experience, when we were inspected by Ofsted in October of 2015 with this new framework, one of the things that they were really impressed with was that everybody in the college, including staff who worked in catering and security, all had an awareness about the importance of safeguarding and also about the importance of mental health, being aware of issues and ability to make referrals to experts where that was necessary.
I think we've got a couple more minutes for anything that you wish to contribute, colleagues. Ian, is there, would you like to wrap up this session in any way in a moment?
Well, I'd like to say thank you to colleagues for contributing. I think there's great expertise and ideas out there, so it's really good to have ideas and comments as well as questions. I think watch this space. As I say, AoC is working very hard on this issue during the course of the year. I hope you'll be able to join some of the other webinars, and that some of you may come along to our conference in December. So thanks for your attention. And thanks to everybody and to MHFE for giving me the opportunity to share my experience. Every college is different, just as every student is different. So I'm quite sure there'll be some things in my experience that won't work for you, but I hope you found it useful and informative.
Thank you very much for that, Ian. And colleagues are contributing their comments, saying that it is very interesting. Also, if there is anything else that we can all support you with, please do let us know. Thank you for the great webinar, and I'm sure that it will be shared amongst others as well as those who have been able to join us today, and for encouraging colleagues to attend the rest of our webinars. I do hope that you have enjoyed the experience and you will feel encouraged to contribute in this way in the future. It does make it easy and accessible, so we may call on you again. Thank you everyone else for joining us today, and I look forward to seeing you in our future webinars. I will stop recording now and then I will finish the meeting. Bye-bye.
Thank you.